In February this year, the whole world woke up sometime in January, and then February, we woke up to the news of COVID-19 spreading all over the world from China. In the February of COVID-19 in this country, Nigeria has recorded, as at September 19th, a total of about 56, almost 57,000 cases, and a total number of deaths of 1,094 deaths. But since the beginning of August, the number of daily infections has reduced by about 50%. From against COVID-19. Dr. Olaolu?
Yes, sir. Good evening, sir.
Yeah, good evening. You are welcome.
Thank you, sir.
Please, you may do some introduction about yourself.
Okay, good evening. My name is Dr. Olaolu Aderinola. I work in the Nigeria Center for Disease Control. I'm an epidemiologist. I work in the Department of Health Emergency Preparedness and Response, and I currently lead as the incident manager for the response in the country at present.
Okay, you are welcome, Doctor.
Thank you, sir.
Yes, just like we are saying, the decreasing number of incidents of COVID-19 that is being reported, we want to know, or I want to ask you to tell our audience whether we are beginning to flatten the curve.
Okay, thank you for that. Indeed, the cases have been reducing based on the tests that we do. Since middle of July, our testing rate actually reduced. These are due to some other factors in terms of the states being able to collect samples from suspected cases, and the testing rate has generally reduced, but in the last 1 week, we've started seeing some increase in the tests being done. We had our highest sample collected in the week of 21st of July. We had about 52,699 samples collected within that week. But the following week was a huge drop to about 24,000 tests done. Then it has now been increasing slightly to 33,000 at the end of 4th of August. Increased slightly 11th of August. It reduced, but as at last week, it increased from 19, close to 20,000 to now 31,000. So we can say that the number of cases we'll have is dependent on the test that we get done. So it's a factor of getting more tests to be done. When we get more tests to be done, we're likely to have more cases. But generally, not just within Nigeria, indeed in the African sub-region, cases are beginning to come low in the African region. But the other caveat for the African region is about testing. And this has to do with people's belief that, okay, COVID seems not to be as severe as we thought it would be in the African continent. We have several people who are asymptomatic or have very mild symptoms. And because of that, people are reluctant to get tested. And we know that in the country, we had issues of stigmatization. People don't want to come to the treatment or isolation centers to be managed. At a point in time, those who are in the treatment centers, because they were apparently not so sick. You find people dancing in the treatment centers and people feeling, no, we don't think this is true. If they are really sick, let's see those who are more or less dying, not knowing that part of the reason of putting them in the treatment center is to be able to isolate them so that they can shed off the virus and not transmit it to others. So in the country, we have the young and the middle age, the young persons who would have very mild symptoms and or some not showing any symptoms. But we know that the load of the deaths we are having is from those 50 years and above and who have comorbidities. Those are the vulnerable group. And these are people, when they have it, they will most likely die. So these are our parents, our grandparents, people with a lot of experience to still pass on to the next generation. So that is the risk that we are now facing. Yes, we have people who have it, they may not even know or just have mild symptoms. But the danger is now passing the virus to the vulnerable ones who now die. For Nigeria, we have not had as many deaths as we have in the developed countries like in the Europe, in the Americas, where in their population they have high number of older persons. And those older persons, yes, their immune status is not as strong as the younger persons, as well as those who have comorbidities that the strong health system has actually been supporting to keep them alive for this long period. So the COVID has made most of them to die. But in Nigeria, we have a very young population. The proportion of persons who are older in Nigeria is not as high as we have in the developed countries. So that has more or less protected us from the effects. And there are still other things that we don't know completely now. And research is still ongoing to know why we don't have so many deaths in the country. But that doesn't mean we should now be complacent. And the need for testing is still very, very important for us to know the burden of the disease in the country.
Thank you, Dr. Lolo. So we can say that the reduction in Nigerians' COVID-19 cases, that's the cases being reported recently, is as a result of the reduction in the number of tests.
Yes, so the test has not been as high as we want it to be. It has been, so we expect the testing to continue to increase. Also noting that we have more laboratories to be able to test more people in the country. You know, before the outbreak occurred, we had just 3 laboratories that could test, and now we have close to about 70 laboratories that can test in the country, which makes access more closer to persons to be able to have this test. So we have a testing capacity within the public health laboratories, over 10,000 per day. But if you see the figures that we bring out on our CTREPs, at times is less than 2,000. I think the peak we reached at a point in time was about 5,000. So we need to test many more persons for us to be able to know that the low cases we are having is because the burden is actually reducing. So we need the testing to move up and the number of cases to be down. That's when we'll be able to know that, yes, we are out of the woods. But based on the tests we've done so far, the cases are not that much. So till we test a lot more people and the cases still remain low, that is when we'll say we are almost out. We're almost out of the woods.
Oh, thank you very much, Doctor. How many people have been tested in Nigeria over this period?
Okay, thank you. Over this period, we have over almost close to 500,000 tests that has been conducted in the country now. WHO recommendation is that we should have tested 1%. So it's actually 480,874 tests that have been conducted. So having 1% of population means we should have tested about 2 million persons now, conducted 2 million tests to and that is a minimum. So we need to test much more in this. And we are working with states to be able to get this done because the response is actually at the state level. We have state emergency public health emergency operation centers activated, and it's within the states that they can now move to the communities to have to get the test done. But one critical thing that we are putting up as strategies to have sample collection sites in our treatment in our various hospitals, so that persons who have fever, headache, symptoms that meet the case definition are actually tested. But more importantly, we are strategizing to see how we can get more persons tested because at the beginning of this outbreak, we're expecting persons to have symptoms before being tested. But now it's been shown that people who don't have symptoms, that is asymptomatics, will have it and can transmit it to others without knowing. So our strategy is now to really strengthen sample collection in our hospitals and also ensure that we do contact tracing so that we can trace every person that once we get a positive person, all the person's contacts within the 14-day period of the incubation period will get tested so that we know that we are able to pick those who are positive or not.
Uh, Thank you very much. For the testing, if I might ask, how much does it cost to do a test?
So within
Is
the
it free of
public,
charge?
okay. So within the public health laboratory network, it's free of charge. It's free of charge, and this is as a result of contributions by the government and partners and international organizations, World Health Organization, Africa Center for Disease Control. We had donations from JACMA. So within the public health sector, this test is free.
Thank you very much, Dr. Olaolu. I would also want to say a lot of people have become fatigued in terms of the corona COVID-19, and have been yearning to get back their lives back to normal. Schools are reopening, churches are being reopened, and a lot of people are not compliant with wearing face masks and the simple hygiene of being the hygiene of washing their hands and social distance. So what do you think? What message do you have for our population who think that the COVID-19 is now, the cases are reducing?
Okay, so for COVID-19, it's more or less like several other diseases that it doesn't show on the face. You can only know when a person has COVID-19 if we test. And we understand that people have been tired because of the lockdown associated with this. We have people who have not really believed that COVID-19 is true or not true, but we know that we have evidence of persons who have recovered, and we now have a network of persons who have recovered from COVID-19, so that awareness now goes to the populace that yes, people had COVID-19 and they recovered. And COVID-19 knows no class. It can affect anybody. It affects the older persons, the young persons, males, females, and one key thing is that till we get people to be tested, we will not know whether anybody has it or not. But if you compare COVID-19 with other diseases we have, like Lassa fever, which you have, the fatality rate is rather low. So it's about 1.9%. If you compare with other diseases, about 20, Lassa fever is about 20%. So it's not as fatal as people thought it was going to be. So that's why some people may feel, well, it's not that serious. Several people have survived it. So if I get it, I'll also survive. But we cannot choose what will happen in our case. And the more reason that people get tested to not just protect themselves, to know their status, but to protect their loved ones, especially the young persons. The risk perception is very low, and they feel, well, if I have it, I'll survive. But the thing is, you may be passed across to other persons. So we're engaging with religious leaders, traditional leaders, so that this message can be passed across. And now that churches are opening, we are using that opportunity to pass the message across to persons, religious leaders, so that social distancing is still done. People wear masks, hand washing still continues. We want our lives back. And we don't want to have the experience that other countries are having, in which after they've now opened the economy, they now have to go back to a lockdown. We don't want that to happen. And we don't want that to happen. We need to ensure that people are wearing masks before they leave their homes, when they're in crowded places, ensure they wash their hands, ensure there's physical distancing done. We need to get this done in a sustainable way. And if you see what China did, China went through the painful period of lockdown, which was very strict, and they are now reaping the benefits of that period in which they waited. So we still need our people to comply. We know that for our country, we are not as buoyant as other developed countries in which you have palliatives that can sustain for a long period. We don't have much of that. And we want people to put this at the back of their mind and ensure that they not just help themselves, but help others to ensure that they keep to these rules. We know that people need to get back their lives, but we should do it with caution. We just have one life to live, and we are not just living it for ourselves, we're also living it for our loved ones, our parents, people who are sick, people who may not be fit as we are. And for us, we are not sure whether if we have it, we'll survive it or not. So it's very important that we all take all these precautions. Thank you.
Thank you, Dr. Olaolu. There is in Europe, in France, the UK, and elsewhere, South Korea, we have been witnessing a second wave of infections. So what do you think, or what advice do you give, or what do you predict will be the trend of the disease in Nigeria? Do you anticipate a second wave?
Well, for us in Nigeria, we are still in the first wave. We've not really gone down below where we'll say the virus is no longer there. And we should keep ahead. Is what we decide as a people that will really help us here. I don't think we can afford another lockdown as a country. And we know that our economy is really taking a hit with what is happening at the moment. The best we can now do is to ensure that we all work together collaboratively. It's an all society approach. It's not just government, it's about institutions, individuals, people watching. We need to really watch ourselves and ensure that when we are going out, we wear a mask, encourage others to wear masks, and give them reasons why they should wear a mask. I think of recent, I went to a pharmacy to just get some over-the-counter medication, and to my surprise, nobody was wearing a mask in that pharmacy. And there were some other customers there. I had to tell them, I wore a mask, I went with my wife, and so then why they know where said their mask finished that day, and that they know that COVID is still there. But the thing is, in those health spaces, that is where those are the places that can really pass the message across to the community. You go to a pharmacy, you see the pharmacist or the pharmacy technician there wearing a mask. It gives you, it makes you know that this thing is serious. But if as health professionals ourselves, we are not wearing the mask correctly, then we will not be reinforcing this message. I know at times when I walk on the streets, I see probably I'm the only person, or maybe I just identify one more person that is wearing a mask. And it might seem to be as if people will feel, is this person that feels he has COVID? We don't have it. So, so all those institutional places, malls, shops, they should enforce that anybody that doesn't wear a mask, that doesn't wash hands, doesn't enter into those spaces. Those are the ways in which we could actually ensure that we get people to implement these public health rules and social measures, which will really help us as a country. Thank you.
Thank you, Dr. Olaolu. There is so much disinformation, which we have discussed. You have discussed extensively on this about COVID-19. Can you probably elaborate a little bit more on the disinformation that is going on in our society about this virus?
Okay, I guess one of the things that people feel some people feel it's not true. Some feel it's just malaria because actually for COVID, it's more or less symptomatic management we are doing. You have a fever, we take care of the fever. You are coughing, and we feel there is this bacterial infection. We give antibiotics to ensure that is done. And more importantly, oxygen is given to ensure that people can recover. As we know, viruses, they usually burn out, but we now need to support the person's immune system to be able to fight the virus. So those are some of the myths that people even felt at the beginning that COVID cannot even survive in Africa. I know, lo and behold, we had our first case. We had to uphold ethics in that initial because some didn't believe it. Some wanted to see the face of the person. And we also know that in ethically, it's the right of the individual to disclose whether he's positive or not and to show himself to the world or not. So we have to ensure that we respect the rights of patients' privacy. And anybody that comes out to say they have it, yes, all well and good, it helps. But the fundamental right of a person is about your privacy and confidentiality and your space. So that initial period, I think people felt it wasn't true. But when the person was discharged, pictures were taken. It was placed. It was in the social media, but his face was covered because he didn't want that. The aspect of stigma, I think people should also know that anybody can fall sick at any time, and we recover. And people shouldn't be stigmatized for having it. We had HIV in the past, still have HIV, and stigma was one key aspect of it. People accessing care. So for COVID-2, even the deaths that have been reported, several of them reported very late, and that's why we had the mortality we had. And you see that most of the deaths we have are from persons 50 years and above who are managing other ailments, who had hypertension, diabetes. Some had transplants done in the past. And these were things that made people die. But now that the deaths are not so many, I know for deaths, you can't really hide it, even if you can hide the disease. Even before we had the cluster of cases we had in Kano, investigations were done to know what was the most likely cause of death in Kano. So we've not had so much reports about that. I know the social media has really helped. And one key thing we've really been fighting at the Nigeria Center for these countries has been the misinformation. It takes a lot of time from us to really respond to the outbreak. Somebody will just be mischievous and want to pass wrong information. People will be saying NCDC is distributing money and all that. So those are, and people felt it's just a way of making money. No, this pandemic is a pandemic because it's affecting several countries at the same time. And we all have access to the internet. We see what the CNN is reporting on a daily basis. So we expect people uh, to trust the government, to trust other partners that are also working on this day and night to ensure that people are kept safe, we reduce this, and a lot of work is going into getting a vaccine for this, and this is unprecedented in a pandemic in which within like a year we're already close to having a safe and effective vaccine to be available. And once the vaccine is available, those are things that would help the economy to for us to go back to our lives to the way it used to be.
Thank you, Dr. Olaolu. Talking about vaccine availability and getting back our lives back to normal, what do you think? When do you predict that vaccines can be available, and when do you predict that people can get back to their normal lives?
Okay, the aspect with vaccines that we can see that the whole world has come together. We know that a disease anywhere is a threat to every other place in the world. The world is a global village, and the virus moves from one person to the other. So the vaccines, there are several candidates at the last stages of the trials, and evidence still needs to be gathered to ensure that it's safe for everyone. And we have trials done in the US, in China, in Britain. We have some tests also being done in South Africa. So the vaccines will be available based on evidence that it's effective and it's safe. Probably in the next few months, I can't give a definite timeline on that, but it's much closer than we have in most of these outbreaks that we have. So in the near future, we'll have it. And the other thing is, before the vaccine is available, the thing we can do is to wear a mask to prevent us from having this, ensure we are washing our hands, maintain physical and social distancing, and also to let people know that the vaccines are, once they are gone through all the trial process, it is safe, it is effective, and these are things that will eventually help us to bring the outbreak to an end and control it.
Thank you, Doctor. Now, there's a lot of clamoring for life to come back to normal, just like we discussed before. And schools are about to beginning to reopen. What do you think about children going back to school? Does this constitute a risk for our children who are going back to the classes?
Okay, thank you. As we all said, children, they've been at home for months now. I think some of them since March, they've been at home, and we need to ensure that education also moves ahead, but in a safe and in a controlled way. And guidelines have been done with the Federal Ministry of Health and partners, Federal Ministry of Education and partners. Guidelines have been put in there on how schools can resume safely, ensure that there are hand washing points, ensure that temperatures are checked, ensure there's physical distancing, ensure that masks are worn. There are also plans to ensure that classes are not crowded, they are well spaced. There are plans to ensure that for some schools, not all the students will come to the school at the same time. Some will come on alternate days based on the peculiarities of the school. It's just important that we also don't want to have an ignorant society. We don't want the educational process to also stop, because that also have a ripple effect on us. And we also know that for our infrastructure, online learning is still a challenge. Might not be a challenge for the affluent persons, but for our public schools, we don't have that infrastructure for every child to have access to education online. And the policy of any government is to ensure that no child is left behind. Education is very important for us to move to the to move ahead as a people. So the important thing is, how do we open the schools safely? And those guidelines are there. There's a lot of consultation ongoing. Risk assessments are being done. consultations done with parents, teachers to ensure that we minimize the risk. Well, we wouldn't say that there's no risk in having an infection when the schools open, but the thing is, we prepare our systems are in place to ensure that when there's a case, we can detect it quickly and ensure that it doesn't spread beyond the few one or two cases that will occur. So those are the things that we're really working towards. It's not a guarantee that there wouldn't be any child or teacher coming down with COVID while the school opens, but it's one of the risks that we will take, but in a controlled way so that the education sector, the health sector, they all work together, ensure that mechanisms are in place to quickly detect, isolate, treat, and test other persons. So contact tracing, all those will be done. These are things we've been working on in our public health system. We've had Lassa fever, we've had measles, we've had meningitis, we've had cholera. So these are things we need that we are putting in place to ensure that the health system responds, working with the health, with the education sector. So it's not like there will be zero cases. We cannot guarantee that. But the thing is, we want to minimize it as much as possible. And if there's any case, we quickly arrest, control the outbreak, and life moves on normally as much as possible.
Thank you, Doctor. This has been very, very useful, very informative information for our people. Some time ago in Kogi and Cross River states, there were very few, almost no reported cases. And now we are hearing some of the cases are coming up in these two states. Are there any states in Nigeria that there's no COVID-19?
Well, as it were in the country, because we all move from one part of the country to the other, all states have confirmed COVID-19 cases. But what we are working with all governments and partners is to ensure that we increase testing all across board. Is when we test, we're able to detect. And in detecting doesn't mean that our health system has failed. No, it just means that we are looking for more so that we can act and curtail the spread. If somebody is asymptomatic and has no issues, but if that person gets in contact with an aged person and that aged person can't make it. So at times, because we now have community transmission, you will not know who has it or who doesn't have it. So it's in our best interest to ensure that we test a lot so that we can pick. And if we test and there's no cases, then no, that is fine. That's what we are going towards. We want to be able to test so many and not detect. But if we don't test, we wouldn't know whether we have so much cases or not. And we've been having good collaboration with this state governments in Kogi and Cross River, and they are working to ensure that once cases are identified, the health system responds effectively to prevent further spread within the states and outside.
Thank you very much. So we can state that it is very important for our people not to be complacent about COVID-19 and to take it very seriously, because we have not yet, the plateau or the curve has not been flattened yet. Now, a lot of international travels has resumed. People are coming in from outside the country, and people want to travel. A lot of people want to get their lives back. They want to go travel outside the country. Some people are coming in. What are the measures in place to make sure that diseases don't spread, through through international travel, particularly through air, traveling by air.
Okay, thank you. As part of the international regulation of the World Health Organization is to ensure that people can move uh, without so much obstacles to movement, goods can move, and the health system should be able to respond to detect cases and respond effectively at various points of entry. Just to take you to about flattening the curve. Flattening the curve doesn't mean that we don't have cases. It just means that we have low cases that the health system can respond to effectively. So even if the curve is flattened, it means we still have the cases with us, but we can manage them well without any disturbance within the health system and also the economy. So looking at the international travel, yes, we know that lives have to come back, economy and trade has to resume, and there are measures that have been put in place, which has been led by the Presidential Task Force to ensure that we protect protect the country from importation of COVID into the country. And these measures have been put on, a portal has been developed, the Nigeria International Travel Portal, which is done in conjunction with partners, the CACOVID, where we have several partners there, and it's hosted on our website. And this is to ensure that persons coming into the country are tested not more than 120 hours, that is 5 days before coming to country, and their tests need to be negative because we don't want importation of COVID into the country. So the first is to have a negative test, and before they come in, they pay so in a private lab of their choice, and they'll be tested after the seventh day in which they come back into the country. So what that does is this: once they are tested within 120 hours before they come into the country, at that point in time they are negative. But we know that COVID, the incubation period, is the period in which a person can have the virus is between 2 to 14 days. So a person can be tested at any point in that time, and it wouldn't be detected. So what is now done is once you have a negative test, another test will now be done on the seventh day, after the seventh day of the person coming to the country. And that test should not be done less than 72 hours. So with that, the person comes into the country and goes into self-isolation or quarantine. The person would not relate, will be with family and friends, will be in a self-contained room. Then on the seventh day, after 7 days, they will be tested at the private laboratory. The private laboratory would have given them a notice a day before the time of testing. And once they are tested, the result will be out between 24 to 48 hours. Once the result is negative, then they now exit from the self-isolation or quarantine in which they are, and they can now do their normal move around freely, also still observing physical distancing that we all do, also continue to wear face mask. The thing is, once you are tested, it doesn't mean you cannot have it. So we always need to protect ourselves even when we are tested. So that is the measure put in place to ensure that we don't have importation of COVID into the country. And the other thing is, it's also possible that those who came in may have symptoms before that seventh day. If they have symptoms, they are being monitored. They call on the whichever state they are. The state public health apparatus will uh, test them, and if they're positive, they are managed appropriately according to our guidelines. For those going out of the country, so they also get tested also in the private laboratories, but the time when their tests will be done will be determined by the country they are traveling to. So different countries have different regulations on how they want to protect themselves, but Nigeria has chosen this path based on the evacuations that we've had in the past, in which people came in and what we discovered is that about 5% of the persons that came in before the opening of the airport were positive. So we want to prevent that to ensure they have a negative test before they come in, and now repeat after 7 days they come into the country while they are self-isolating. So those are the measures put in place to ensure that businesses still open and we are still protecting our country and also livelihood of Nigerians.
Oh,
Thank you.
thank you very much, Dr. Aderinola. Our time is running short now, Otin. I would like to put our main question before you. What would you like to say, or what would you say about the response of Nigeria to the COVID-19 pandemic? Are we really winning the war against the disease, considering the fact that we've not had as much fatality, like other countries outside, abroad, like the United States and in Europe? Will you say that we are winning the war against COVID-19?
Okay, thank you for that question. So that question will not be a yes or a no, but it's just to highlight steps we've taken before this came up. Before we had our first case, at the Nigeria Center for Disease Control, with partners, the port health services, we've prepared. We manned our points of entry to ensure that we don't have importation. And we knew that because of the incubation period, we may actually have any case that will slip into the country. And the first case was picked in Ogun State. Well, some will say it was luck, but one thing about luck is you have to be prepared and the opportunity presents itself for you to be a lucky person. So if you say it's luck, yes, the health system was prepared and that's why that person was picked. We are not sure that was the very first, but the health system was able to pick that person. Our surveillance system has improved. We have all the public health emergency operations centers activated in all the states. We have the PTF coordinating this response at the national level, which has been very excellent, coordinating the whole society. We've been having communications going out to persons about the disease and what they need to do to protect themselves. We've been conducting training on infection prevention and control in our health facilities. There's been provision of personal protective equipment for health workers to ensure that they don't get infected, to be able to reduce the infection rate. We've been supplying personal protective equipment and commodities to virtually all the states in the federation so that they are prepared and have all the necessary medicines and consumables to respond to this. At the beginning of this outbreak, we had 3 laboratories. We now have about 70 laboratories, 71 completed laboratories that can now test. There's only one state that doesn't have a laboratory to test, and we are working hard with that state to ensure that that is put in place. We have treatment centers being set up in all the states of the federation. We have about 129 treatment centers available. We have about 7,000 beds available to take care of persons. Healthcare workers have been trained to manage cases, close to 2,000 in our health facilities. On infection prevention and control, we've had 23,445 persons trained to reduce this. And what we've seen is that there's been a lot of collaboration of Nigeria and the African continent. We knew that our health structure, our health system is not that strong. So extra effort was taken to prepare for this response. We have the Africa Center for Disease Control coordinating this response at the Africa continent. We've had the WHO also supporting us. And what we are having is that we've been able to respond to reduce the mortality that we have. We know some other things are going well for us as per population dynamics, our population distribution. But by and large, we were able to quickly take decisive actions in closing the schools when they were closed so that we don't have so much spike. The lockdowns that were done, they all had benefit because it made people to know more about COVID-19 and things that need to be done. It seems that it's not as scary as people felt it was going to be. And that's why we are now having this like, oh, it's not too much of a big deal, and people are more concerned about their livelihood and their lives at this time. But we know that the two need to go together. So by and large, we've done the best we can, but we know that we can still do more, and we're still working very hard with partners. And we want the Nigerian people to also support us to ensure that they are keeping themselves safe, ensuring they are wearing their mask, ensuring physical distancing, washing their hands with soap and water at all times, avoiding crowded places. These are the key things that will help all of us to ensure that we bring this outbreak to a halt. We can control it, and life moves on for us to gain our lives back as it used to be.
Yeah, thank you, Dr. Olaolu. We very much appreciate your presence in this section, and we thank you for giving, a lot of information about the efforts that have been put in place by the federal government to control this pandemic. I can say from our discussion that with the Nigerian public should not be complacent about the pandemic, that the number of cases, reduction in the number of COVID-19 cases we are recently witnessing in the daily test reports from the states, maybe as a result of the reduction in the number of tests, but that the COVID-19 is very much with us here in Nigeria, and that people are dying from the sickness, and that we should, our audience and the Nigerian public should always keep the basic principles of wearing a face mask, social distancing, and washing their hands, basic hygiene, as a preventive measure to prevent this pandemic. So thank you so much. We appreciate your presence. And we also want to thank Enough is Enough for organizing this section on risk communication to enable Nigerians to know what is happening to about this pandemic. So we thank you for coming, and we thank our audience, people who are listening to us. Unfortunately, I could not pick some questions from the audience to put across to you, but we are looking forward to another section soon, where we can, link up with the audience and have a number of questions that they want to know about the pandemic. So thank you very much. I appreciate your time with us.
Thank you. Thanks so much for having me. Just want Nigerians to go out there and get tested. Thank you.
Thank you.